Hello, good afternoon, everybody. My name is Laila Adwan Kamara, and I'm team lead on Ghana Somubi Webinar, also known as Ghana Participation Program. And on behalf of the program and our partners, I'd really like to welcome attendees to today's webinar. And the webinar today, it's super exciting. It's all about the value of interface meetings between self-help groups and Metropolitan, Municipal and District Assemblies. And I'm just going to take you through a tiny bit of housekeeping before I introduce and hand over to Peter Badimak-Yarrow. So just in terms of the housekeeping, just so you know, we've got closed captions available if you have any trouble with the audio or being able to hear it. So at the bottom of your toolbar, you should be able to see a little icon that says CC. And if you click on that, you'll be able to get captions. Now, unfortunately, those captions are only available in English. I hope that any French speakers are able to read the message. My French isn't going to be able to read out that message for you, I'm afraid, but I hope that all is clear and makes sense. And then I think the other thing that I would note is, as we've been putting in the chat, and many of you are interacting there already, for the chat function, it's just a little single speech bubble, and you can type in there and write to just the hosts or to everyone. You can put in your chat, you can talk to each other. That's fantastic. We want to hear where you're from, and also let us know of any technical issues in the chat. But if you'd like to submit a question for the moderator or the speaker today, then please do use the Q&A button. That's the one which has two little speech bubbles and it says Q&A. And that just really helps us manage the questions, especially when a lot of them come in. Okay, so that's the housekeeping part done. So I would really like to hand you over now to our moderator for today, which is Peter Badimak-Yarrow, who is the Executive Director of BasicNeeds-Ghana. And Peter is a development worker of nearly 25 years experience and is a leading mental health advocate in Ghana. And he's been working in Basic Needs, a leading mental health and development organization, for over 20 years now. Just before the webinar, we were checking how long it's been and said that we absolutely need to have a celebration. It's been a delight to work with Peter over the last few years. So Peter has dedicated his work efforts to improving the situation of women and men, girls and boys with mental health conditions, their primary carers, families and communities in Ghana. And I'm really delighted to hand over to Peter now to run the rest of the webinar. Thank you so much.
Thank you very much, Laila, team leader of Ghana Somubi Webinar. Good afternoon from Ghana. Good evening, good morning, everyone. Thank you for making time to join this conversation. A really exciting conversation that I look forward to hearing. As we know, Ghana Somubi Webinar is a consortium of partners that are led by Options, team leader being Laila. And Basic Needs, one of the consortium partners, has been working with self-help groups, and we are excited to have one of the program managers, Mr. Adam Dokrugu, speak to us on this very important topic about how people with lived experience in their numbers are engaging and self-representing. Adam is a project manager of nearly 20 years to 25 years, just as me. He is very experienced in mental health and development project startups, and his work and academic experience span through social work, governance, sustainable development, with a strong focus on program management. He specializes in partnerships and networks, and is an advocate in mental health, disability, and human rights. He's been one, as I mentioned, a leading member working on supporting and being at the background to help self-help groups do their own thing. And we are happy to have Adam speak to us. This is a very interactive session. Feel free to tweet at us. Look for the handle for Ghana Somubi Webinar, Basic Needs, and the rest of the consortium partners, as well as UK FCDO. And also post your questions, as you have said. Lila has so kindly said. So on this note, I welcome you all and ask Adam, please present to us. Over.
Good morning, good afternoon, good evening to you, wherever you are joining us from. I'm happy once again to welcome you to this webinar presented by Basic Needs-Ghana. We're going to look at the role of interface meetings between self-help groups of people with mental health conditions and Metropolitan, Municipal, and District Assemblies. This webinar is organized by Ghana Somubi Webinar. And the Ghana Somubi Webinar is a 4-year disability program in Ghana with a focus on mental health. The program is run by the options-led consortium consisting of Basic Needs-Ghana, Sightsavers, Tropical Health, and King's College London. It is funded with UK aid from the UK government. The program focuses on 4 key areas. 1, promoting stronger policies and systems respecting the rights of people with disabilities. 2, scaling up high quality and accessible mental health services. Reducing stigma and discrimination, and generating evidence to inform policy and practice. Now let's look at the background to interface meetings. I want to begin by saying that several poverty intervention programs have been implemented by government with the aim of improving the lives of people who are considered to be vulnerable, marginalized, or excluded. Now, among these social intervention programs in Ghana, we have the Livelihood Empowerment Against Poverty, the National Insurance Health Scheme, the National Youth Empowerment Program, and District Assembly Common Fund. Now, people with mental health conditions and their primary caregivers, members of self-help groups, have often reported having challenges in their attempt or efforts to access these pro-poor intervention programs that are designed to improve their lives. They have reported having challenges in their attempt to access the District Assembly Common Fund, which is meant for people with mental health conditions and people with disabilities. They have challenges accessing LEAP, therefore they do not benefit from the quarterly cash transfers. They also have problems in accessing psychotropic medicines under the government's free mental health policy. Now let's look at what a self-help group is. We are saying that for our purpose, self-help group is any mutual-oriented initiative directed by people with mental illness and their family members. You can see in the photo, this is a self-help group in a community called Porto in the Bono East region, that is in the Kintampo North district. Now, what is an interface meeting? We are saying that an interface meeting is a facilitated face-to-face engagement between members of self-help groups and key officials of Metropolitan, Municipal, and District Assemblies for them to deliberate on measures to enhance the inclusion of members of self-help groups into the programs of the MMDAs. Now, Basic Needs has been facilitating these interface meetings, by coaching self-help group members to enable them articulate and present their issues to these officials of MMDAs when they engage them. Now, these interface meetings have been going on before this program. But just to say that from September 2020 till August 2024, we have been able to facilitate and coordinate a total of 144 interface meetings in the regions that the program is operating. Now, what is the purpose of these interface meetings? One, we have stated that it is to facilitate direct engagement between members of self-help groups and their respective MMDAs. The interface meetings also promote understanding, accountability, and responsiveness of MMDAs, to the rights and needs of people with mental health conditions. We also look at the fact that self-help groups and relevant duty bearers are able to familiarize themselves with one another. The members of self-help groups get to know who the officials of the MMDAs are, and then the MMDA officials also get to know who the self-help groups are and where they are located. Furthermore, the interface meetings serve as an avenue where representatives of self-help groups directly lobby duty bearers to address their concerns. Interface meetings create an opportunity where they come into direct contact with them, so they can ask all the questions or seek all the clarifications they otherwise would not be able to ask because of the gap or the gap in communication between them. But this interface meetings brings them into direct contact with duty bearers. Furthermore, self-help groups understand the roles of the agencies and know where to seek help with specific issues. So they know that social welfare has a role to play when they are applying for support from the Disassembly Common Fund. They know the role of National Health Insurance Scheme, and they know the role that the Social Services Subcommittee of the Assembly play. So interface meetings bring them into direct contact with these agencies, and they are able to appreciate who to contact, which specific agency to contact when they have issues. It also affords members of the self-help group the opportunity to know at first hand, what the responsibilities of the duty bearers are, and the duty bearers also have the opportunity to know at first hand the problems or the issues that people with mental health conditions face in their various communities. Let's look at typical topics that are usually discussed during interface meetings. During interface meetings, the focus has always been the following: access to the 3% component of the District Assembly Common Fund. The other major one is the access to free enrollment of the National Health Insurance Scheme for people with mental health conditions and their caregivers. Then there's also the issue of access to LEAP cash transfers. Additionally, they also look at access to secure livelihoods, because there are some of the interventions that are implemented, and it makes available resources for excluded groups or marginalized and poor people to be able to engage in some income generation activities, and people with mental health conditions are usually left out in these interventions. They also advocate, or it's also an avenue for advocating for improved access to psychotropic medicines. And finally, it is also for them to address the inadequate data on people with mental health conditions, because this data is critical when assemblies are planning their programs. Now, who are usually the actors in these interface meetings? So we have mentioned that the interface meetings are usually between self-help groups and key officials of MMDAs. So at the MMDAs, we are looking at the district chief executive, we are looking at the coordinating directors, we are looking at the planning officers, we're also looking at budget officers, Then other agencies, such as the National Health Insurance Scheme, the Department of Social Welfare. We're also looking at the Social Services Subcommittee. Then we have district leaders of the Ghana Federation of Disability Organizations and representatives of the self-help groups as key actors during interface meetings. Now, having facilitated interface meetings, what are some of the good practices we think are worth sharing? Now, collaboration is a key, so we always adopt a collaborative approach. Now, how is this done? Self-help groups identify their priority needs. So these are needs that they think can be addressed by the assembly. So they first of all have to identify these needs. Then BasicNeeds-Ghana, as I mentioned earlier on, will coach or support them to articulate these needs during the interface meetings. So you can see in the photo, this is a session ahead of an engagement with the Kintampo South District Assembly. Again, Basic Needs have taken the responsibility to facilitate these meetings. So we set up, or Basic Needs will set up the meetings between the self-help groups and the district assemblies. So basically serve as the bridge between self-help groups and the district assemblies. Then we also think capacity enhancement for self-help groups are key to the success of interface meetings. So we think that we have also trained members of self-help groups on rights-based advocacy, and then we have also trained them on other ways by which they can lobby the MMDAs on their own. So they've been trained on rights-based advocacy, they've been trained on safeguarding, they've been trained on leadership, with a specific focus on the challenges women in leadership face. They've been trained on group development, and they've also been trained on conflict management, so that they have enhanced capacity and they use these skills during their engagements with MMDAs on their needs and their rights. Now, to make sure or to enhance the success of interface meetings, we consider raising awareness on mental health to be key. So, as a result of that, the training officials of 32 MMDAs to appreciate the rights of people with mental health conditions has been done. Then officials of MMDAs, as a result of these engagements, now agree that mental ill health or mental illness is a disability, and that qualify people with mental health conditions for inclusion in the social intervention programs these assemblies usually roll out. Then another best practice we can talk about is addressing mental health stigma. We all know that mental health stigma is a critical barrier, that must be addressed, because it can limit the support people with mental health conditions will receive from MMDAs. So we think that persistent stigma and misconceptions about mental ill health or mental health conditions has to be addressed, and also looking at the importance of follow-up meetings or engagements and sensitization to reduce barriers that are induced by stigma. Another best practice or good practice we think is worth highlighting is consistent follow-up engagements. Now, we know that it doesn't take one occasion or one visit to these duty bearers to get your case addressed or your issues addressed. So we think that it is important to undertake follow-up engagements. Therefore, it takes a lot of focus, it takes tenacity, it takes commitment between members of self-help groups and MMDAs to make progress. And we think that it is necessary to assess and ensure commitments are realized. The follow-up engagements also ensure that relationship between the self-help group and MMDAs is strengthened. And then it also helps to identify and engage key officials, to give consideration to the issues of people with mental health conditions. And also, it helps the people with mental health conditions to identify key allies within the MMDA so that they can easily link up with them when they have issues. Now, another good practice that we want to consider is working with community volunteers. Community volunteers usually help in supporting and mobilizing self-help group for interface meetings. And the volunteers ensure that they are able to enhance sustainability of the interventions or the engagements. Additionally, they ensure continuity even with the instability of the conditions of the self-help group members, because there are some who will relapse, and when they recover, they have to join the group slowly again when they have engagements with the MMDAs. Now, there is a case study we want to share with you about the important role community volunteers play. Now, the Ateltaba self-help group is in the Boku West district, and Clement Akudago is the community volunteer who is supporting this group. And because of his role, the group has been able to gain or get support from the District Assembly Common Fund to support their activities, and then members of the group have all been registered with the National Health Insurance Scheme. But Clement says that, we need to get to a point, and I want to quote directly, we need to get to a point where members of self-help groups will no longer go from one office to the other, at the District Assembly to demand inclusion and respect of their rights. This will not last. What we are doing now is creating a cordial relationship, establishing rapport, and emphasizing mainstreaming mental health into medium-term development plans now and in the future. So Clement thinks that this approach will ensure sustainability of the outcomes of interface meetings. So what are some of the outcomes of interface meetings that we can talk of? We think that interface meetings have translated the promises that MMDAs make into tangible support. So you can see a presentation of working equipment to members of a self-help group in the Nkranza North District. What lessons have we learned from this? We think that self-advocacy and persistence are key to the success and sustainability of interface meetings. Additionally, self-help groups benefit from proper training, and self-representation will enhance the effectiveness of interface meetings. Furthermore, self-help groups require strong leadership if they have to overcome stigma. And we think that once they are able to overcome self-stigma, they are able to engage effectively with their MMDAs. Going forward, we think that the learning of this of interface meetings can be adapted by others. So we think the program has made significant strides in improving the lives of people with mental health conditions, and continued support, awareness, and advocacy are key to sustaining these efforts. We also think that the Ghana Federation of Disability Organizations should integrate these practices into their ongoing efforts, because they also engage with the MMDAs in one way or the other. Furthermore, we think that the Mental Health Alliance should leverage on the lessons learned to influence policies and practices that support people with mental health conditions more effectively. Additionally, self-help groups have been encouraged to collaborate with district-level leaders of GFG in their future engagements with MMDAs. This will ensure that their voices are heard at the district level. Additionally, facilitated interface meetings between representatives of self-help groups and officials of MMDAs, to strengthen their relationship and ensure continued support for the self-help groups. Then we think that the local assembly members should be encouraged, to support self-help groups in their electoral areas anytime they are having these engagements. So we think that these suggestions emphasize the importance of continued collaboration and strategic advocacy. Thank you very much, and we look forward to your questions and contributions. Thank you.
Thank you so very much, Adam, for very insightful presentation. I've enjoyed it. Even though we've been in the action together, it's now sinking in, and all too soon it has come to an end. But we have a few more minutes to interact, and please feel free to do so. I think I've seen a question that's asking where we work. We work Basic Needs. When I say we, I mean BasicNeeds-Ghana. We work in Ghana, virtually throughout the country, depending on our funding scale. But with Ghana Somubi Webinar program, we have been in various locations, purposefully selected to make the maximum impact across the country, from the Upper East, Upper West, Northern Region, Accra, and through the grants program, it's virtually been a nationwide program. I think a number of grantees I've seen on the call. I've seen Mihoso and others that have been grantees to the Ghana Somubi Webinar program, and so it has been all over. I've seen Hello Francis, a song from Africa Disability Institute, and Rose Dapa from PC MHO in Tampo South, and everyone else. I would mention you as I see your name, but so far that is what I've seen. Yes. So, any question? I'm being supported by Lila. Have you found any question else that we could ask Adam or any one of us to respond to?
I'm sure people are just reflecting. We're waiting eagerly for people to add their questions to the chat. But if I could ask a question of Adam and yourself, Peter, I would love to hear more about how the Mental Health Alliance interacts with the self-help groups, because you mentioned them in the recommendations. So I would very much love to understand that a little bit further. Thank you.
Absolutely. I'll allow Adam to take a bit of water. The Alliance, which again has many participants from it here, is the NGO network, or call it the movement of organizations in mental health and disability, trying to push the frontiers for greater rights and needs of persons with mental health conditions and persons with disability. And they are also in their various corners, through the support of Basic Needs, facilitating self-help groups, or through some other resources they get, facilitate the establishment and operations of self-help groups. And because of this umbrella body, there is opportunity to amplify what self-help groups are pursuing within fora that for some reason self-help groups may not be present, but the members of the Alliance are worthy representatives of self-help groups articulating their voice, not replacing them in any way, but ensuring that self-representation of persons with mental health conditions are realized, including encouraging some of them to be part of members of the Alliance as persons or experts with lived experience. So the recommendation is to the effect that the Alliance is an effective ally of the numerous self-help groups dotted around the country, where even some of them are working closely with individual members, Alliance member organizations. So let me take it here, and then we can allow others. Over. Any other question? Did you find it interesting? Does anyone to share experience? Mr. Jules Kwesi Tagbo from Ghana Psychological, or Dr. Kwesi Tagbo from Ghana Psychological Association and Africa Disability Institute. I see you. You're welcome. As I said, I have seen a few others that are known, and we'll mention them. There's Johnson Ziem, Ku Bichiri from the Resource Link Organization. Thank you for joining. And Dominic Unigura, our own colleague. Welcome. Yes. Hello, Daniel Taylor. I want to say good afternoon to you as well. Please feel free to share experience related to work with self-help groups.
So, Peter, there's quite a few questions in the Q&A, and I've also sent some direct to your chat, so you can address those with Adam.
Yes.
Lovely.
So, Shasha Ofori says, how can we found self-help groups in Ghana? Is there a database? Are there any specific for schizophrenic? Well, yeah, for a community of persons living with schizophrenia. There is yet another one. Adam, do you want to have a go? Are there self-help groups for caregivers? You can combine that. Same from Shasha.
So thank you very much. We have a number of self-help groups across Ghana. The database may not be in the public domain, but within the office and the program, we have a database of self-help groups that we support or work with. Whether there is a specific group for persons with schizophrenia that I do not know of, possibly this could be a question for the Mental Health Authority or maybe Ghana Psychological Association. So, but across Ghana on our list, we have 272 self-help groups that we operate or we support. Which is the other question? Let me. All right. So we don't have specific groups for caregivers only. The groups that we work with are mainly people with mental health conditions, people with epilepsy, and their primary caregivers. So they come together to form the self-help group, and that is why we say that the self-help group is any mutually self-supported or self-directed group by people with mental health conditions and their families. So we don't have groups that are specifically made up of caregivers.
Okay, Adam, I'm keen that we get as many questions covered as possible. We have Nana Hawa Abdul Malik from Gede Foundation. I would like to ask what the metrics or indicators for measuring success are during these interface meetings. And if I could combine that, Leslie Robertson says, I may have missed this in the talk, but how is the training of the self-help groups organized? Is it conducted formally or on an ad hoc basis? And who provides the training? So if you can just take those two questions.
All right, so the first one, how do we measure?
Well, Penny just said this is the first time hearing about it. Well, it's good. Let's keep talking about that. Adam, please go ahead.
Yes, so how do we measure success of these interface meetings? What we do is, first of all, to look at what was and what is now. What we have observed, so we have reports that we generate, and we also have testimonies of what these interface meetings have generated or have produced. What we have realized over time is that there is increased acceptance of people with mental health conditions as people with disabilities. Generally, earlier on, you go to a district assembly and they tell you that these people with mental health conditions are not part of the disability fraternity. So it took a lot of effort, constant engagement, and awareness creation for them to come to accept that people with mental health conditions are part of the disability fraternity. They are registered with the Ghana Federation of Disability Organizations, and therefore they need to be included in the programs of the assemblies. So you now have district assemblies that hitherto did not provide any support to people with mental health conditions in their social protection interventions, now doing so. So we have very typical examples of the Zabzugu District Assembly, where over a week ago, out of 23 people who were supported from the Common Fund, 9 of them were persons with mental health conditions. Support has been extended to them in Gushegu, Nkranza, North, Husunya, Ajima, and in the Upper East region, Zebila, Bongo, Bolga Municipal Assembly. So hitherto, these assemblies did not support people with mental health conditions. And that is how we measure our success. And even for the fact that the people with mental health conditions can go to the assembly and engage with key officials on their needs, for us, we think is a success. Secondly, for them to be able to walk to the social welfare department with their applications to request for cover letters or for recommendation to the fund management committee, for the approval of the assembly, for them to be supported, for us is a measure of success. And there are individuals who have, received various kinds of support, ranging from cash grants to equipment, such as freezers, sewing machines, and some have even been supported to rear animals. So this is how we gauge our success. Which one was the second question?
Adam, there was another question about how is training of self-help groups organized?
Exactly.
Yes,
right.
Yes, which is a great one.
Right. So I do capacity assessment. What do the self-help group need to be able to function? So these are very tailor-made trainings, to suit the level of understanding, including level of education, level of literacy, and even the general understanding or level of understanding of the people we deal with. Now, our trainings are not very formal. They are not very formal because what we have realized is that if you contract or hire somebody to come from outside to train, because they have not been engaging with the groups, particularly non-literate populations, you end up having facilitators coming to present things which look more academic. So our trainings are tailor-made and directed to address the specific capacity gaps. So for instance, how the groups have been trained on how to engage with MMDAs. So on taking them through rights-based advocacy for them to know what their rights are, how to lobby, who to lobby, how to package your message. So these are usually conducted by staff of the program, staff of BasicNeeds-Ghana, who usually lead in the trainings. And the trainings are delivered in the communities where the self-groups are found. So we usually will meet them either at their place of meeting, where it is not convenient for a training. We will look for a place that is convenient for training and conduct the training there. But they are not strictly those kind of formal workshop type of trainings that are conducted.
Thanks, Adam. And if I could just step in, because it looks like Peter has fallen off. This is what happens with the internet sometimes. But there's a few questions actually in the chat that I just wanted to pull out because they didn't make it to the Q&A. So Abdul Hamid was asking whether you have data on mental health prevalence in Ghana and if you have data on stigmatization around mental health, as well as asking, apart from medication, what other interventions are available for people with mental health conditions?
So we do not, especially for the purpose of this presentation, we do not have data on the number of people or the prevalence of mental health conditions in Ghana. But at least everybody for now refers to the statistics quoted by or provided by the WHO. So that is what I will encourage people to refer to. So apart from medication, so the groups that we support at least have been supported to engage with their MMDAs. So even beyond this program, the groups have established relationships. They have known who to talk to, where to get them, and what to say. So for us, that is an addition. Similarly, the groups have been supported where funds have allowed us to engage in secure livelihoods. This is not part of this program, but at the core, the groups are making efforts on their own. So when they even go to the district assembly, besides asking for medication for the mental health units where they go and receive treatment, they equally have been asking for support from the assemblies to engage in livelihoods. And I did mention that some have been supported with fridges to sell water or other cold stuff. Some have been supported to rear animals. And even the fact that there are groups where you have over 90% of the group members being registered free of charge or enrolled onto the national health insurance free of charge. And that is because of these engagements. And to say here that the NHIS has made a passionate appeal. Last week we met with these some of the scheme managers in Bono East region, Northeast and Northern region, and then in Savannah region. They said they have targets to meet, and they are relying on us to see how many more people we can link up with the National Health Insurance scheme for them to enroll. So apart from the medication, at least there is free enrollment and free renewal of membership. They have support from their assemblies, their individual capacity on various subject matters have been enhanced. And even the fact that they are able to form groups and support one another, in the community, that bond of unity, that peer support. If they don't get support anywhere, they get support from the groups they belong. So for us, these are other support they receive apart from medication.
That's fantastic. And I think to some extent you've answered the next question or two from Erla and from Thomas, but perhaps you have a few more examples. So Erla's question was about whether you can share any examples of success. Like I said, I think you've shared some, but you could maybe add some more. And then Thomas was asking, look, what are the opportunities for scale up with your approach? You know, because we're thinking about interface meetings and they are very in depth. You know, there's over 200 MMDAs in the country. So yeah, it would be great to just hear from you a little bit more on those two topics. Thanks, Adam.
Okay, so let me pick them one by one. So examples of success, I think one I can mention is the fact that we have been successful in getting members of self-help groups to enroll onto the National Health Insurance Scheme. So besides their mental health conditions, they have access to free healthcare when they have other physical conditions. Now, again, to say that the self-help groups have served as, you know, a platform or a space to mobilize people with mental health conditions for self-representation. At least they are able to advocate, they are able to argue or press home their demands, and even on policy issues, because they are organized, they are able, even if they don't understand this is a policy issue, they know this is something that needs to, that affects us. So for instance, when there was a delay in the establishment of visiting committees and mental health review tribunal, they came out, you know, using Vox Pop to talk to authorities. And believe you me, with the support of this program and the Mental Health Alliance, within 2 weeks, when people with mental health conditions started talking, you know, the Mental Health Review Tribunal was established. So for me, this is great success. And then even for some district assemblies to come to the recognition that mental health is, or people with mental health conditions belong to the disability fraternity and need to be covered by social intervention schemes that the assemblies roll out, for us is a big success. As the volunteer in Boku West stated, what they are doing now is just laying the foundation. They are waiting, they are hoping a time will come, they will no longer go from office to office asking for inclusion, because that will not be sustainable. But they believe that with what is going on, laying that solid foundation for MMDAs to deliberately and intentionally plan for people with mental health conditions in their programs, for us is a big success.
Yeah, that's so interesting, Adam, and it really highlights the rights-based approach that you've taken with supporting members of self-help groups. And I think it's just so important to ensure that they're able to access the social protections that they're entitled to. I think there are two more questions. I know we're nearly at time, but I would love to just beg your indulgence and see if you could answer these. They're quite interesting. So Ken has asked the question, I think it's really a question about sustainability. And he's wondering whether to ensure sustainability for self-help groups, whether there could perhaps be some advocacy for a national legal framework to regulate and support the self-help groups. I guess he's thinking of that from a funding perspective. And that's a really interesting question, isn't it? Because we've got lots of legislation and regulations already, which don't necessarily lead to sustainability in other areas, unfortunately. So yeah, it would be great to hear your thoughts on sustainability for these groups. And I know you've done a lot of work with the groups individually to help them plan ahead as well. And then interestingly, a question from Jones, which is kind of linked as well. I mean, it's also feeding into this idea of funding for these groups for people with mental health conditions, etc. And he's asking about whether you're going to be championing this idea of perhaps transitioning the COVID levy into more of a mental health levy to support and boost funding for mental health activities, which would perhaps include empowering self-help groups. So some difficult questions for you, but I think great ones to end on, if you don't mind.
All right. So let me start from the last one, that is funding for these groups, and the suggestion that COVID levy could be maybe modified or transformed into a levy to support the mental health fund. That will be perfect if the politicians will agree. But I'm sure if you have followed media reports over the last 2 days, both the two major political parties in Ghana are both saying they will cancel. In fact, one says outrightly that he will cancel COVID levy. So possibly that will be a good entry point to say, well, if we are canceling COVID levy, which we're already paying, why don't we channel it to mental health funding? So that could be an opportunity for self-help groups to advocate for that. Now, in terms of advocating for legal framework to support self-help groups, one of the things that this program did with self-help groups and largely to the parent organization was to provide technical assistance to the Mental Health Society of Ghana, as a way of strengthening the capacity of the umbrella organization or the mother organization, so that they are able to strengthen their governance system, they are able to mobilize membership, they are able to provide the capacity that is needed for members of these groups. But beyond that, they also belong to the Ghana Federation of Disability Organizations. And I think that broadly, if there is the need for any legal framework that will support the survival and sustenance of these of the groups, I think that it will be very welcome. But that will be another, I don't want to call it a project, but that will be another big initiative that we can work towards. But all that we are looking at is a day where they are self-representing, they are self-directed, and they are able to champion their own issues, so that we as organizations will have very minimum input into what they do.
Thank you, Adam. I think that's a fantastic note to end on, but if you don't mind, I just wanted to make some closing comments. I mean, firstly, to thank you, of course, for a fantastic presentation and to answer quite difficult and testing questions on the hoof. I think that was really informative for the audience, and also for our audience. The engagement and the questions have been really interesting for us. And if I can perhaps just wrap up with sharing some reflections that Dominic put in the chat, which I thought were just so lovely and really highlight the benefit and the impact of the work that you do, Adam. So Dominic has talked about, from his experience with engaging with officials, government officials over the years, he says that sort of the kind of questions that he gets asked have really shifted. In the past, it was very much about asking, how are people with mental health conditions going to meaningfully utilize social protection monies like the District Assembly Common Fund, so having this sense of doubting that they can use those funds. Whereas he says now there has really been this shift, this sort of greater confidence in the capability of people with mental health conditions to be able to do that. And I think that really speaks to the work that you've done and the ways in which you've, addressed stigma and really educated people. And I think one of the other comments in the chat is, of course, from your colleague Dan Taylor from Mind Freedom, asking to please connect and brainstorm a bit more on the funding question. So I think there's some follow-up work and connections being generated as a result of this webinar. So if I can just let the audience know, thank you very much. As the webinar closes, you'll be taken to our webinar page where you can sign up for further webinars. There's one more this week, which is talking about the implementation of district mental health care plans. And then there are 3 more webinars in September on a range of really exciting issues, including psychotropic drugs, the implementation of the Mental Health Review Tribunal, and also how we've ensured that disability and mental health inclusion has been really embedded into policy work with government. So if we can wrap up there, thank you very much, Adam. Thank you, audience. Thank you, everybody who's helped make this webinar happen. We're really grateful for everybody's time. Have a lovely afternoon. Bye.
Thank you. Bye, everybody.